So in today's topic, it's food allergy, chapter 36, page number 486. Page 486, chapter 36, food allergy. If anyone is joining late, please help them out with the topic name. So food allergy, it is a series of pathological immune reactions that usually pathological means it looks severe. Okay, you will be sick. Okay, it affects your internal organs severely. So these are pathological immune reactions which will usually manifest in your uh, stomach, GI tract, okay, or on your skin, or even your respiratory tract. That means you will not be able to breathe properly. Okay, so these are the pathological immune reactions that happens when you eat certain food. Okay, clinical reactions to food components which are usually pathological. Okay, and your immune system is involved in this reaction. That's why it's a pathological immune reaction. It could be IgE mediated, that is immunoglobulin E mediated, or non-immunoglobulin mediated. Okay, either your immunoglobulin will go and attack your cause this allergic reaction, and in some cases it's not your immunoglobulin that is responsible, just the tissues or cells how it respond to certain food allergies. Okay, certain other definitions which you may find it confusing with food allergy. Food intolerance. Food intolerance or aversions are usually mistaken as food allergy, but it is not. Okay. Food intolerance is any unpleasant experience or any unpleasant adverse reaction to a food in which immunity is not involved. Okay, neither psychologically you think that it is bad, or not, your immunity is also not involved. It's just your body is not reacting to the food component properly. Okay, here your immune system is not involved, and it is not because of certain food protein. For example, lactose intolerance. Okay, it is a metabolic disorder in which your body does not have this enzyme called lactase to digest the lactose that is present in milk. Okay, so your body does not know how to digest it. So indigestion will be there. Okay, it's completely physiological. Food intolerance is physiological. It's not psychological. It's not immunological. It's just physiological situation in which there is something in your intestine which your body cannot digest. So definitely you will have some reaction to it. That is food intolerance. Food allergy, as we have mentioned earlier, it's a reaction to food component of the reaction of your immune system to food component. Here immunity is involved. Okay. And it usually manifests as either GI tract complications, respiratory tract complications, or in some cases on skin, you will find rashes, hives, and all. Food aversion, it is psychological. Okay, it's your mind that makes you not to eat this food. You are you have an aversion towards that food. Okay, it's your mind that makes you, I don't want to eat this food, I hate it. For example, just like in pregnancy. Okay, in pregnancy, in the first trimester, mothers have certain food aversions. Okay, that leads to morning sickness and all. So that even if that food goes into your body, okay, the food towards which you have certain aversion, if you eat that food is not going to cause you any harm. Okay, you will not have any allergic reaction to that food. You will not have any intolerance reaction to it. But it's your psychology, it's your mind that it hates that food for no particular reason. Okay, so that is food aversion. Then we have adverse food reaction. There are many types of adverse food reaction which are often confused with food allergies. Adverse food reaction means something that is toxic. Okay, like food poisoning and all. It's not allergy. food poisoning is not allergy, okay? And infection can spread through an adverse food reaction. Allergy is not infectious. If you are suffering from food allergy, doesn't mean someone else with whom you stay is also suffering from the same allergy. But adverse food reaction, you are suffering from an adverse food reaction, there are high chances that someone else who has had the same food may also have a similar reaction, that is adverse food reaction. And food poisoning reactions are often uh, after it often affects one individual, more than one individual, okay? And even if the food, for example, you had some Chinese hakka noodles, okay, and you had a adverse food reaction. After a month, again you had Chinese hakka noodles, you will not have any issue. Okay, maybe the way how the first one was made was unhygienic, and that gave you issues. Okay. Then you have exercise-induced anaphylaxis or food-dependent exercise-induced anaphylaxis. What is anaphylaxis? Allergic reaction. Okay. It's a rare disorder in which individuals develop the IgE-mediated hypersensitivity, that is allergy. Okay, here your immunoglobulin E is responsible along with exercise. Okay, so uh, in these patients who suffer from EIA, exercise or food on their own does not cause any allergic reaction. Only the combination of these can trigger. Okay. When like for example, when the patient is exercising within 2 or 4 hours after eating any food, okay, the patient will have some allergic reaction. But uh, in the gap of the 2-3 hours of exercising, the patient did not had any food, there will not be any allergic reaction. Okay, so timing is important here. What is the time span between you exercising and having food? Okay, there should be a good gap. Okay, do not eat food immediately after exercise or immediately before exercise. Otherwise, the patients here will have some bad reaction. Okay, so that is very rare condition. Only the combination. For example, you had a sandwich. Okay, without any exercise, you had a sandwich. There is no reaction. Okay, you are completely fine. The next day, you did some exercise, and immediately half an hour after the exercise, you had a sandwich. You will have a reaction. It's not the food that causes the allergy. Okay, it is not the food that causes hypersensitivity here. It's the combination of exercising and having food that is causing a allergy here. Okay, so these are the definitions. Is it clear to all? Certain definitions that you should not misunderstand with food allergy. So in food allergy, the way how your body reacts, okay, it can be classified into immunoglobulin E mediated disorders, non-immunoglobulin E mediated disorders, and mixed immunoglobulin E and cell mediated disorders. Okay, so certain food when you eat, either your immunoglobulin E, okay, that's a part of your immunity that is involved. In some allergies, immunoglobulin is not at all involved. In some allergies, immunoglobulin along with cell-mediated immunity. Okay, these things are involved. Okay. So examples, IgE-mediated. For example, urticaria. Acute urticaria means hives. If you know what hives are, you get this not skin rashes. It's like small bumps, okay? Small bumps all over your face, hands, neck, somewhere on the body. Okay, small bumps will rise all over your body. Okay, it will arise all over your body. That is hives. So that is urticaria. Okay, another name for hives is acute urticaria. In that, immunoglobulin is involved. Okay, it's a immediate gastrointestinal hypersensitivity. That is also one way. Pollen associated food allergy. If pollen, any flowers pollen gets mixed with the food and you eat it, okay, that could lead to anaphylaxis, okay, hypersensitivity. Some certain meat can cause this anaphylaxis. Okay, eating beef, red meat, certain kind of meat, if you're allergic to it, if you eat it, that could cause hypersensitivity. In that also IgE is involved. Okay, and also food induced, exercise induced anaphylaxis. Just now we have discussed, in which only the combination of exercising and eating food, when it is done together in a very short span of time, it will give you allergic reaction. So that is IgE mediated disorders. In non-IgE mediated disorders, for example, lactose intolerance, caffeine hyperactivity. Okay, uh, if you have too much of caffeine, you become very anxious, stressed. Okay, hyperactive. Some infectious agent. Okay, some infectious agent has entered your system, and certain food phobias. Okay, you are scared. Some people are scared of spicy food. Some people are scared of sticky food. Okay, they have phobias. Okay, those things come under non IgE mediated disorders. Then in mixed IgE and cell-mediated disorders, in all of them, eosinophils are a type of your white blood cells. Okay, eosinophils are released. Okay, it could be esophagitis, gastritis, gastroenteritis, colitis, dermatitis. That is inflammation in your esophagus, your stomach, your intestine, your large intestine. Okay, your skin inflammation will start. Okay, because not just immunoglobulin E that works internally, but cell mediated disorders, it will give you rashes, okay, externally as well. So both of these things are involved in giving you a food allergy. Okay. Then coming to pathophysiology. So intestinal mucosa, there is a mucus lining in your intestine. It is continuously being exposed to a lot of antigens from your food, and also your intestinal microbiome itself. Okay, your intestinal mucosa is exposed to it, food and microbes, etc., on a continuous basis. So your intestine has to identify which microbe is good, which is bad. Okay. So whenever your mucosal barrier breaks down, if you're not having enough fiber-rich food, okay, if you have destroyed your intestinal mucus barrier, when this breakdown happens, a large surface area of your intestine will be exposed to the antigen, and that could lead to some pathological state and sensitization, etc. Okay, so that is how the pathophysiology of allergy will start. That is where sensitization, hypersensitivity will begin. Okay, so in case of IgE mediated food allergies, immediately as soon as you have those certain food in which immunoglobulin E is responsible for giving the hypersensitivity, you will have hives, swelling, anaphylaxis. Anaphylaxis means you will not be able to breathe properly. Okay, your face will swell up. Okay, you will have hives. Hives is that red, itchy, small bumps that come all over your face, neck, or any part of your body. Okay, that is hives. And it is a life-threatening condition because uh, your trachea, your windpipe closes simultaneously. Okay. And if immediately an antihistamine is not given, the person will not be able to breathe, and it could be a life-threatening condition. So common food allergies that causes this IgE-mediated food allergy are egg, peanut, milk, some tree nuts, shellfish, soy, wheat. Okay, in children it is very common. And a child can develop allergy to any food because while growing up slowly one day after the other, children are being exposed to new and new varieties of food. Okay, so they are highly at the highest risk of developing food allergies. Okay, but when they grow up, Usually, majority of the kids, they outgrow the food allergies. Then you have the non-IgE mediated food allergies, in which only gastrointestinal symptoms will be there. Okay. For example, you will vomit a lot. You will have diarrhea. Okay. In some cases, blood will be there in your stool, weight loss, difficulty in swallowing. So just your GI tract is involved. No respiratory issues, no hives, no swelling. Just your GI tract, any part of your GI tract will have some indigestion issues or some distress. Okay. And it's not that life threatening. Coming to common food allergies, first is cow's milk protein, beta lactoglobulin. Okay. Most of the kids are allergic to this. There are other 25 proteins also present in the cow's milk, which can cause allergy, but beta lactoglobulin is the most notorious one. And usually, when you have allergy towards cow's milk, it's not just because of one protein. You are allergic to more than one protein of a present in the cow's milk. Then you have soya protein. So that also develops uh, a cross-reacting response in infants when it is proven that a cow's milk allergy is present in the child. So any child who is allergic to cow's milk also has a chance to be allergic to soya milk as well. Soya protein intolerance, it is usually seen in infants when they have persistent diarrhea and they are given soya milk, and along with being fed with soya milk, they continuously have diarrhea. Okay. So that's how you can diagnose it, if it is a soya protein allergy or not. It's common in children because their intestine is not mature enough. Okay. The intestine is not mature enough to understand soya protein. Okay. The intestine only knows mother's breast milk. Okay. And cow's milk, which is very similar to it. Okay. But soya milk, since it is a plant-based protein, it is foreign to the human body. Okay. Foreign to the infant's body. So anything foreign has new and foreign could lead to some hypersensitivity reactions. Then peanuts, cocoa nuts, peas. Okay. These can also cause the reactions in which airway, the child will stop breathing. Okay. And it gives asthma like symptoms, peanut allergy. Then egg white. Yolk is not an allergen, but egg white is commonly an allergen. And also certain vaccines which are prepared using the egg white protein, like MMR vaccine, mumps, measles, rubella vaccine. Okay. That can also give you the same reaction. If the child is having an allergic reaction after getting vaccinated for these specific vaccines, it's understood that the child may have allergy towards egg white as well. Then certain citrus fruits, it may not cause allergy, but it can aggravate any airway disease, hyperactive airway disease. Okay. So if the child is having a peanut allergy in which hyperactive airway disease has been triggered, and after that you give the child some citrus fruits, it can become more aggravated. Then shrimp, crustaceans, and fish. This is like prawns and all. Okay, seafood. That is also a most common allergen. not just in infants or children. Crustacean is crab or the group of crab and lobster. Okay, they all are crustaceans. Spices, yeast. Okay, sometimes these are also allergic. Yeast present in bread and all. Then MSG, that is Ajinomoto. These are the ingredients used in Chinese cooking. That can also cause allergy. Symptoms are like there is numbness, weakness, heart palpitation. In some situation, earlier it was called as Chinese restaurant syndrome because MSG was only used in Chinese cuisine, not in other cuisines. Then wheat and gluten allergy. Wheat also has a protein that is called gluten. Okay, it can cause ingestion when it is eaten, or even if you inhale, if the person inhales wheat flour while it is being cooked, okay, that can also lead to allergy. There is a difference between wheat allergy and gluten intolerance. Wheat allergy means immediately you will have allergic reaction. Intolerance means you eat food, but you usually suffer from indigestion, bloating, and all. It is not life threatening. Gluten intolerance is not life threatening. Okay, you just have to avoid gluten so that your stomach does not have any issues. Okay, you will not fart a lot. You will not have bloating, burps. Okay, indigestion, stomach aches will not be there. Okay, if you avoid wheat, if you have gluten intolerance, but wheat allergy is life threatening. It can block your airways as well. So pathogenesis, there are three important factors involved in how uh, a food allergy can start in a person. Okay, first is your genetic predisposition, which means children who are born to atopic parents. Okay, they have a risk of developing food allergy by 60%. Okay, so your genetics plays an important role in determining if you what kind of food allergies you will have. Usually, the food allergies are also similar among parents. Parents who have a lot of allergies, they also give rise to children who have allergies like allergic rhinitis, asthma, parents who have asthma, dermatitis. Okay, uh, their children will also have certain food sensitivities. Reason being, if the mother is having a lot of IgE, okay, if you have a lot of allergies, you will have a lot of IgE in your blood, hemoglobin E in the blood, okay, in the maternal blood as well. So when the child is being born, when you cut the cord, the mother's placenta, the umbilical cord also has the same IgE high concentration blood. Okay, so the child is born with that kind of blood. Okay, so that also accelerates the chances of hypersensitivity reactions. Next is early exposure, as I mentioned in soya protein. Okay, since the child is not able to digest cow's protein, cow milk, if you switch it with soya milk, okay, the child will have issues with soya milk as well because it is foreign, it is new to the child's body. Okay, so early exposures can also lead to allergies. The more you are exposed to certain kind of food, there are high chances you may develop allergies towards it. For example, gluten allergy. Gluten allergy is common among Punjabis in India. Okay, Punjab is a state that is highly dependent on wheat, right? And gluten allergy, wheat allergy is also seen in high rates. It is also seen in Punjabis. People who are overly exposed to wheat, they themselves have the highest risk of developing wheat allergy. So that is a form of early exposure. Then defects in the gut mucosal barrier. Some children are born with a not a strong gut mucosa. Okay, that is the intestinal mucosal layer. Your intestine is covered with a mucosal layer that protects the intestine from harmful bacteria because your intestine has microbes already. Okay, and these microbes should not colonize the intestine and cause infection from within. So you have this mucosal barrier that prevents the microbes from entering the intestine to stay only inside the lumen of the intestine, but not enter into the cells of the intestine. Okay, but if there is some defects in this mucosal barrier, if your body is not able to produce enough amount of mucus and all, it can lead to issues, gut issues. So that's the pathogenesis. Is it clear to all so far? In clinical manifestation, what are the symptoms of allergy? Generally, you will go into a state of anaphylaxis or shock. Okay, anaphylaxis means it's a combination of symptoms like your respiration will stop, you will not be able to breathe, you will have a face full of swelling, okay, skin rashes, redness, swelling, okay, and because of this breathlessness, not having enough oxygen supply, the person may go into a state of shock or coma. That is anaphylaxis reaction. Okay, but breaking it down system wise, what are symptoms you will see? So in the gastrointestinal tract, you will have nausea, vomiting, diarrhea, malabsorption, which means just now if you are recovering from a food allergy, your intestine is still recovering. You can't dump a lot of food in your system. Okay, you have to be on liquid diet, semi-liquid diets, and slowly build up your tolerance. Failure to thrive. Okay, the child will not be able to grow properly. Blood loss, protein loss, abdominal pain, stomach pain, cramps, bloating. These are seen in GI tract. Your respiratory system, continuous sneezing, repeated sneezing, rhinorrhea, which is you will secrete a lot of mucus from your nose. Okay, runny nose, what we call as runny nose is rhinorrhea. Then wheezing, that faint sound that comes from an asthmatic patient when they breathe in, you can identify that specific sound of breathing. Okay, the difficulty in breathing, that is called wheezing. Okay, cough, bronchospasm. Bronchospasm means the trachea, the bronchi are becoming smaller and smaller. Okay, so there is very less air that can pass through. Then dyspnea, that is breathlessness. On skin, what happens? Lips will get swollen up, angioedema, itching, rash, urticaria means hives. Okay, that small bumps, red small bumps, itchy bumps all over the face. Then eczema. Eczema is that dry skin that is very itchy. Okay, so these all are skin allergies. Other symptoms seen is joint swelling, swelling in the joints, arthalgia, pain in the joints, headache, apathy. Okay, you will feel very irritated, irritable, and hyperkinesis. Okay, so these are the symptoms of clinical manifestations of food allergy. So diagnosis, how can you rule out allergy? It is usually difficult because of practical challenges. Okay, uh, but if you have a food history or if you have an in-depth family history collected, you can find out what kind of food allergy a person may be suffering from. So you have an elimination and challenge test. So in elimination and challenge, you have to eliminate certain kind of food. Okay. A list of food will be given to you to avoid, and your health will be monitored. So it can reduce the symptoms as well. Then you have the skin prick test. So these are also reliable food sensitivity tests in which certain small doses of allergens would be inserted under your skin. It's a dermal injections usually given. Okay, and wherever the skin reacts, that is where it's identified that you are allergic to this particular allergen. Okay, usually in the on your back or on your forearm. Okay, uh, a small tiny bit of allergen like a pollen or a food will be put. Okay, and then a small scratch is made, or a prick on the skin is made, and this allergen is put on that prick. Okay, or sometimes dermal injection is given, uh, not the subcutaneous injection, just intradermal injections are given, and that areas are marked and seen that if you have allergy or not after 48 hours or something. Then immunological test. So they can't diagnose, but they can be used for supportive causes. Okay, because if you have a lot of IgE, okay, if you have if you have a lot of circulating IgE or tissue bound IgE, it means your body is undergoing some allergic reaction. So these are the main tests used. Apart from that, intestinal biopsy can be taken, okay, to study the intestinal tissue and understand what kind of food allergies this intestine is suffering from. ELISA test can be taken. Enzyme linked serum analysis can be done to find out immunoglobulins that are responsible for food allergies. Then RAST test, radio allergosorbent test. Again, this is a radio immunoassay test to detect IgE antibodies, specific IgE antibodies, which are usually seen in cow's milk allergy, soya allergy, peanut allergy. So these are very common allergies. In these common allergies, there is a specific kind of IgE, immunoglobulin E secreted. Okay. So if this specific IgE is also secreted in the patient's body, it's confirmed that the patient is suffering from either of these foods. Okay, and using a food history, you can identify which specific food it was that caused this issue. The treatment is elimination diet. From the name itself, we can understand uh, in elimination diet, things that are excluded from the diet. Okay, once you identify what is a causative agent here, or what is the food allergen here, that has to be excluded from your diet. And usually in when you're dealing with children, infants, cow's milk protein allergy is the most common food allergy. So cow's milk is eliminated. Okay. If the child is not having any lactose intolerance, breast milk should be continued. Since some infants with cow's milk allergy also has soya milk protein allergy, soya-based protein is also not given to the infants. Some other milk like almond milk, okay, it can be given. Millet milks can be given. If the child especially is below 6 months of age, okay, do not give soya based formulas. After 6 months, start inducing soya and see how the child reacts. If the child does not have any allergies, you can continue the soya products. Drug therapy, certain antihistamines, prostaglandin synthase inhibitors like aspirin, disodium chromoglycate. Okay, these are the pharmacological drugs that is useful in some symptoms of food allergies. Rantac can also be given. Steroids are only indicated if it is a mixed type of food allergy in which IgE and cell-mediated immunity both are involved. Prognosis: by 3 years of age, usually children are able to tolerate uh, previous allergic food, which means when the child grows up in preschool and all, whatever the child was allergic to at a young age of infancy and toddlerhood, usually by the school time, children grows out of that allergy. Okay. So it should not be a cause of major concern. Cow's milk, usually the cow's milk allergy, which is seen in young children like infants, once they get into the school and all, they can tolerate cow's milk as well. Except for seafood and peanuts. Okay. Except for seafood and peanuts, all the other common food allergies, it usually the child will grow out of it. So that's all for today's session on food allergies. If you have any issues, you can mention in the chat box.